Hi, this is Dr. Kaustubh Mahajan. I am a consultant neurologist attached to Raheja Hospital. So today we are going to talk about forgetfulness, dementia, and Alzheimer's. So are these all three things equivalent or they are different things? So first let me define these three. Forgetfulness is basically when you are forgetting things, as simple as that. Second is dementia. Dementia is a neurological condition or a disorder in which there are problems in four important neurological domains, which are, one of them is they will have memory issues. Second is they will have problems with perception. Third is problems in language. Fourth is problems in behavioral changes. And last would be executive functioning. So when you have problems in all of these domains, then they will compass into a group called as dementia, and of which in dementia is just a term. There are many causes for dementia. One of the important and very common causes for dementia is Alzheimer's, which is clearly related to age. More the age, more the chances of the person having Alzheimer's. So now let's give two examples to explain how these three things are different. Now I am in the room and suddenly it's 4 p.m., 5 p.m. and I yawn. I feel that I have to have my coffee. So I go into the kitchen to get the coffee, and before I go into the kitchen, just my phone rings. Now I get distracted to the phone calls. There are many things which are being told on the phone call. And then I come to the kitchen and imagine what am I doing here? Um, then I go back. That's it. So I don't know what I was doing in the kitchen and I forget. The second example is I take my phone in my hand to make an important phone call. I remember that I have to call my colleague for something, and then suddenly there's a message which pops in. I go on the WhatsApp. There's an email pop up. There's another Facebook pop up, and then I just forget. I just scroll down on those things, and then I forget why I had picked up the phone, and I just forget to make that important phone call. And then my colleague calls, "Why didn't you inform me?" So I think most of these examples are in routine practice, commonly being seen by each of us. And then the next thing comes in our mind: oh, am I getting old? Am I getting dementia? Oh no, my grandmother had dementia. So is this Alzheimer's dementia? How bad it was. So then you start getting anxious. Now, so let's say these examples at least may not fit into what we call as dementia. So let's dwell more a little bit in deep. We have two kinds of memories. One is short-term memory, and second is long-term memory or remote memory. Now, the short-term memory is what we also is equivalent to the computer RAM, random access memory, which basically is a function of the hippocampus, which is mainly involved in Alzheimer's dementia initially. Short-term memory loss is when you forget things in the working memory, what has been told now, what you decided just now, somebody decided to go to the room and you forgot. So those things come in the short term memory. Whereas in the long term memory, they are remote things, like the language which you have uh, learned, or who was your school teacher in first standard, or what was the name of your college, all those things. So these memories come in the long term memory, and they are usually uh, equivalent to what we call as the hard disk in computer, and they don't get wiped away. It's the short term memory which gets wiped away in early dementia, mainly Alzheimer's. But understand that the working memory, the hippocampus, which is important for it, can at a time deal with only 4 to 5 actions or things. Unfortunately, in today's world, where there are lots of distractions, mainly from the mobile phone, uh, you pick up the phone to make a phone call. Suddenly, there's a WhatsApp pop up. Suddenly, there's a Facebook pop up, and these things divert your attention. and then your hippocampus is filled with 4 to 5 different things which have distracted you. Now, because they are taking up the space which is was initially taken by the fact that you had to make a phone call gets shifted, and that's how you will tend to forget things. Now, in this, if there was a newspaper clipping or something in front of you which made you think that you have to inform the colleague, um, like there was a blood report, as a doctor I had to inform it to my colleague that this report is abnormal. Now that can behave as a visual cue, means I've forgotten to make the phone call, but I again sit back and see the report, and then I it clicks, and that report behaves like a visual cue, which makes me wonder that, oh, this report I have to inform my colleague, and then I go back to the memory in spite of the distractions of the phone call of the phone. So when you get a visual cue, you will remember what you had forgotten. And this is what happens in routine forgetfulness. In dementia, this doesn't happen. Now, with visual cues, they may not be able to get back to uh, the memory which they forgot. So that is one important differentiation. Also, one important differentiation is that patients with only forgetfulness are aware that they are forgetting things, whereas patients with dementia, uh, they are not aware that they are forgetting things. Invariably, if you're complaining that you're forgetting things, be calm, because then that is not dementia. Dementia is a much bigger condition in which the awareness quotient is also gone. Okay, so that's about dementia. In dementia, there are many types: frontotemporal dementia, then diffuse Lewy body disease dementia, which is somewhat similar to Parkinson's disease dementia. Then there is Alzheimer's dementia, and there are many more. Initially, we have to differentiate whether it's a reversible dementia or whether it's an irreversible dementia. Irreversible, we mean degenerative dementias, in which age is the most important factor, and as the brain ages, the degeneration increases and the patient keeps worsening. So once we differentiate it between reversible and irreversible dementias, then we have to differentiate in irreversible dementias which kind of degenerative dementias, so at least we know ki, what we are dealing with it and how to handle this situation, and is there any way to improve this uh, condition. So definitely there are many ways to improve this condition. If you ask me whether there's anything to reverse this condition, in a case of irreversible one, it is difficult, but at least things can be done so that it can be pushed further, it is not allowed to worsen further in a rapid way, and there will be some improvement which will be seen in the cognition. So last thing is that in dementias you should know that patients who are taking care of such patients with dementia, they eventually get burnt out. um, when you have a patient with dementia, if you try to tell them that please remember this, I'm not going to repeat it again and again, uh, invariably you will have to change this attitude, because a patient with dementia is going to forget whatever is in the recent memory, and he will not be aware of it even if there is any visual cue. So it will just increase your frustration, and it will increase your burnout, and it will make you get problems as a caretaker. So changing the attitude towards patients with dementia is important, for which we need counseling for the caretakers also, and then things are understood, and then even the patient with dementia is kind of comfortable, even the caretakers are comfortable, and things are handled in a more smarter way. Coming back to forgetfulness, which I think most of the patients, most of layman people are getting affected, but as we just discussed, your working memory or recent memory will be affected if there are more than 4 or 5 things at a given time uh, bothering it. So focus, attention is a very important part of your memory. And unfortunately, with the recent mobiles and apps, the focus is getting slowly and slowly worsened. Last thing is to understand in dementia, there are three, four things which are important, which one should know, that not all dementias are genetic. If somebody in your family has dementia, you will also get dementia, is not necessary. In dementias, the process through which the shrinking of the hippocampus starts is not when the symptoms have started. It has already started 30, 40 years prior, in which the patient remains asymptomatic. And when the symptoms have actually started, the patient's problem in the brain has actually gone to beyond 80%. So that's why the reversible becomes difficult in dementia. So, what are the factors which, if done early, may help a person not to get dementia? So, one of them, unfortunately, it's not a medicine or something. It is mainly lifestyle changes, which everybody can do. So, what are they? So, one is, and most important, is sleep. When you have an uninterrupted good sleep, the later half of the sleep is the REM sleep, which is important for building your memory. If your sleep is interrupted most of the times, and if your REM sleep is not much, then you will start your memory hippocampus, the toxins which have to be cleared from the brain, they unfortunately are not cleared in that REM sleep because it is interrupted, and then there is damage happening along those toxins, and that's how the shrinking of the brain keeps worsening over the period. And then when there's a tipping point, you start forgetting things. So one important thing is sleep. Second is exercise. So you need a good circulation happening into the brain, so that the clearing process of these toxins, which is a normal thing, which as every connection in the brain is made, some toxins will be made, and those toxins have to be cleared. So they won't be cleared if there is no good REM sleep. They won't be cleared if there's no good circulation. So for your good circulation, you need to be physically active. If you are not physically active, you have a sedentary lifestyle, the arteries will be narrower, and the chances of the clearing process getting weak is more. And that's how. So being physically active is a second important thing. um, Last is trying to avoid certain things which will keep your arteries narrow. So mainly carbohydrates and sugary things, it is better that you keep it on the lower uh, quantity. I think that's enough for today, and thank you. If any questions, let me know.